Hello everyone, and welcome to this audio podcast. This audio podcast is part of the Labzquad Omega. This audio podcast as part of the Storm Squad. This audio podcast as part of a ZtormLabostix production. Through this audio podcast, continuing on from and looking in on following in from using following in on from from the audio podcast in the series of using patient and public involvement to challenge or tackle disparities and promote healthcare services. This audio podcast will go into some of the discussion as part of this series. So, health professional, healthcare professionals cannot rely solely on the nature of an event to determine whether it is stressful, as a young person's appraisal that plays a central role in shaping their psychological and physiological responses. Young people's involvement in their own healthcare increasingly encompasses the acquisition of self-care skills, health-related knowledge, and the self-monitoring of conditions or of illness or illnesses. There has been sort of qualitative research describing HQRL, or health-related quality of life and lived experiences in young people. Poor HRQOL indicates healthcare conditions have profound impact on young people's lives. Young people have described in amongst literature. Young people have described a range of challenges and experiences, including not feeling normal, frequent absence from school, relying on family, friends, and healthcare providers in challenging times. At the same time, coping is central. Is coping is has been contextualized in amongst literature to be central to the life of person or persons living with any sort of chronic illness or condition. And poor coping is linked to increased risk of in around in around morbidity or mortality. Coping strategies at the same time are therefore fundamental to dealing with challenges. However, there are few investigations surrounding coping in young people with CKD and those with different healthcare conditions. Collaborative practices through patient and public involvement and patient-centric initiatives have also been evidenced as being pertinent. Efforts in this regard would require collaboration to bridge gaps, highlight challenges, and preclude disparities, enhancing 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 healthcare service user experiences in context of supporting best practices. This should include healthcare professionals to offer guidance and surrounding coping strategies aligned to evidence-based perspectives and comprehension surrounding a link between illness and disease or illness and conditions. This would be advantageous. That draws this audio podcast to a close. This audio podcast as part of the Labzquad Omega. This audio podcast as part of the Storm Mode Squad. This audio podcast as part of a ZtormLabostix production.